considered to be premature month, the awareness month for prematurity. Why at all we have to discuss about it? To embrace a premature birth and to tolerate the burden, to tackle the burden, we need to create more and more awareness. So what is preterm birth? A usual delivery happens only after 40 weeks, 9-month completed pregnancy. A premature birth is a birth of a baby which occurs less than 37 weeks. So what is the incidence of a premature birth? It's around 11 to 16%. Every year we are seeing increasing rates of premature birth. So who are at risk of these premature births? Many patients have no known risk factors. Few of them have identifiable risk factors. So coming to a past history or a medical history, previous history of premature birth poses a risk by itself to have a further premature birth. Previous surgeries over the cervix or traumatic deliveries might also pose risk as a risk factor. A short cervix diagnosed by transvaginal ultrasound usually makes the patient at risk. Coming to present pregnancy complications like vaginal bleeding or a subchorionic hemorrhage or a threatened abortion in early pregnancies also put the patient at risk. Vaginal discharge infections during the pregnancy are also high risk factors. Coming to the lifestyle factors, smoking, diabetes mellitus, obesity, elderly, as well as patients less than 17 years pose a high risk for premature. So what are the warning signs for these premature delivery or a premature labor? Premature labor doesn't mean the patient always will give birth from premature baby. There are ways to prevent it. Prolong the labor, prolong the pregnancy and help the patient come out of premature labor and hence can deliver a full-term delivery. So what are the warning signs? A patient might complain of low backache, a dull low backache, contractions occurring frequently, the uterine contractions, abdominal pressure, pain in the lower abdomen associated with diarrhea, vaginal discharge, rupture of membranes, the patient might complain with leak. So how do we prevent these preterm births? First of all, a detailed history to be taken. If at all a patient is at risk, that is diagnosed by a short cervix, the patient will undergo a cervical cerclage in the present pregnancy. Previous history of premature births, definitely we'll have to put them on supplementations with more progesterones, give them bed rest, adequate bed rest. If there are vaginal infections or vaginal discharge, to be treated accordingly. Of course, the lifestyle, that is if at all there is diabetes mellitus or history of smoking, we need to be damn sure to control it. So we need to educate our patients about what is it, how to go about it. What are the complications of premature birth? So a premature baby always poses a risk. When it grows, it has to undergo many complications. So as such, it might be a low birth weight baby because it's born less than 37 weeks. It might have a developmental delay, cerebral palsy, vision problems associated with prematurity. And of course, the maturity of the lung, as we know, would not be complete. They might go in for respiratory distress syndromes. So when a patient with premature labor lands up, we need to see if at all it is she's benefited or the fetus is benefited by prolonging the pregnancy, and hence the patient will be put on tocolytics, that is a uterine relaxants, then given medications to improve the maturity of the lung, and hence the pregnancy is prolonged. So what to do if a patient lands up with preterm labor? Patient needs to be told about the warning signs and told she should land up immediately to the hospital or the doctor whom she's consulting, and hence to be treated. So this year the prematurity theme is a patient's embrace is the best therapy. That is, a skin to skin contact for the baby is the best therapy which a mother can give. That is the kangaroo method. So let's all show the awareness, educate many patients, and hence prevent preterm birth too. Thank you.